He's thirsty. He's been staring at that glass for 6 hours. He can't drink it, not because he doesn't want to, because the water makes him feel like he's drowning. He's terrified of it, and he has no idea why. What is rabies? Rabies is a virus. Specifically, it's a lysovirus, and unlike most viruses that just want to replicate and move on with their lives, rabies has a very specific plan. It wants your brain. Not just to infect it, to take it over, to use it. Rabies is spread through saliva, usually from a bite. Most commonly, dogs, also bats, raccoons, foxes. Globally, around 59,000 people die from rabies every year. One person every 9 minutes. While you've been watching this video. Stage 1, the bite. You get bitten, the bite heals, you feel completely fine, and then nothing. For weeks, maybe months. The average incubation period for rabies is 1 to 3 months, but it can be as short as 1 week or as long as a year. Why the difference? Because the virus doesn't travel through your blood, it travels through your nerves, physically, inch by inch, moving along the nerve fiber toward your spine, then toward your brain. During this entire journey, your immune system cannot see it. It's hidden inside the nerve. Your body has no idea anything is wrong. Stage 2, prodrome. Then, one day, something shifts. You get a headache, a fever. You feel tired, anxious, weird. Maybe tingling or pain where you were bitten, even though that wound healed months ago. That's the virus arriving at the nerve endings. Your body is starting to notice. Too late. Here's the thing about this stage. It's the last stage where anything could theoretically be done, and almost nobody knows they have rabies yet. Stage 3. The brain takes over. The virus is inside the brain now, and it gets to work immediately. There are 2 forms of rabies at this stage, furious rabies and paralytic rabies. About 80% of people get the furious kind. Confusion and aggression set in suddenly. The patient becomes unpredictable, violent even. Not because they want to be, because the virus is rewriting their brain chemistry. Then comes hydrophobia, fear of water. The virus has hijacked the swallowing reflex, not by accident, deliberately, because the virus spreads through saliva, and if you can't swallow, you produce more saliva, which makes you more infectious. Aerophobia comes next, fear of air. Even a slight breeze on the face triggers convulsions. Doctors have to keep patients in sealed, still rooms. Then hallucinations begin. The patient sees things, hears things, periods of calm, followed by sudden terror. Moments of clarity where they know exactly what is happening to them. Stage 4, the end. Within 2 to 10 days of neurological symptoms starting, the patient enters a coma. Organ systems begin to fail. And then, once clinical symptoms appear, survival is almost impossible. Recorded survivors can be counted on one hand, globally, in all of recorded history. The twist. Here's the part that makes this disease genuinely maddening. Rabies is preventable. Not kind of preventable. Completely, totally, 100% preventable. If you are bitten by an animal that might have rabies and you go to a doctor immediately and receive post-exposure prophylaxis, the vaccine series, the virus will be stopped every time. The vaccine has a near-perfect success record when given before symptoms start. So why do 59,000 people still die from it every year? Because most of them don't have access to the vaccine, or they don't know the animal was infected, or they can't afford treatment, or they live too far from a clinic, or no one told them a dog bite could kill them months later. The disease isn't winning. The system is losing.